time. You're in tune with the Weekend in Wyoming program. Wonderful to have you along with us on this very somber occasion. We're going to switch gears a little bit here now, and I have Dr. Jeffrey Chapman, who's Chief Medical Officer at Cheyenne Regional Medical Center, and we're talking about the COVID vaccinations. Good morning, Dr. Chapman.
Good morning, sir. How are you?
Good. How are you doing this morning?
I'm doing great.
Okay, we want to talk about the COVID vaccinations. One reason that I asked for this interview is I think there's a tremendous amount of misinformation out there. Somehow this whole thing got politicized. So we're going to cut right to the chase. Are the COVID vaccinations safe?
Yes, I think without question they are. And I think, one of the biggest testimonials I can give to that is that I have my family members all vaccinated. I've had discussions with a number of friends who've had family members with concerns, and I recommend it. In the world, unfortunately, nothing is absolutely perfect. In the sense of that there's always going to be, some one-offs or rare things that can happen, and there are some rare things that happen with the vaccine. But I think when you compare it to the issues that people have when they actually get COVID, I think they are just minuscule. If you look at the efficacy of the vaccine, CDC report just came out that basically says that you're over 10 times more likely to be hospitalized if you haven't had the vaccine, 10 times more likely to die if you haven't had the vaccine, and 5 times more likely to get infected. And again, it is not perfect. I think that one of the things that I hear and I understand from people is, gee, there's this rare chance I may have an issue if I get the vaccine, but a lot of people who have COVID, it's just like a cold. And there's some truth to that, but we're seeing more and more data that even people who have mild infections have what we call post-COVID or long-haul syndrome. Mm-hmm. And it's a significant percent. If you look at people that actually hospitalized, and again, there are so many numbers about all this, I don't want to, state this just as straight fact, but it's probably 60 to 70% of people have long-term symptoms in the form of shortness of breath, fatigue. They talk about foggy heads, mental lack of mental clarity. And the people who get mild infections, it's probably in the 30%. And I always talk to people about, do you know anybody personally that's had anything like this? And I have a number of friends and coworkers who've had family members, or they themselves have had COVID, not had to be in the hospital, and they just talk about the shortness of breath, the rapid heart rate, that sort of thing. So there's a lot that goes with it. I think the other thing that certainly I hear from people is concerns with the vaccine about fertility and what happens if I want to get pregnant. Is there any chance this is going to alter my DNA? And if you look at how the Moderna and the Pfizer vaccine work, they have mRNA, which is half of DNA, for lack of a better term, that never enters the nucleus where we have DNA in our cells. And basically it just creates a recipe for the cells to create proteins like are on the COVID vaccine, and then our bodies build an immune response to them, and they are gone very quickly. And so I know that, until it's been 10 years, no one can say, you don't know about the long term. But if you just look at the science behind how they work, there is zero chance that they can alter your DNA for a number of reasons. I'm sorry, that was a mouthful.
No, go ahead. Feel free.
Tell me what else I can answer.
Well, I have you're talking about after effects. I wanted to toss this out there. I have a friend of mine who had COVID in November of last year, around Thanksgiving. He got pretty sick, and he says, yeah, it was real bad, and I got sick. But the thing is, here we are almost a year later. He still doesn't have his sense of taste and smell back. Is that unusual?
Yeah. That is unusual, but not unheard of. Unfortunately, I read a story that was interesting. A gentleman who actually made his living tasting food and wine, and the same thing happened to him, and it made it so he couldn't work. And so it's not rare, certainly not common, but it happens.
Will he ever get it back?
No one knows for sure. there's actually some people working on retraining, and there's some work on how we retrain by stimulating the taste buds, and part of taste is smell, and so, but no one knows. Most people do, but I've heard some reports of rare cases where people do not get it back.
Now, this friend told me that when he's around something that's extremely odoriferous, like, say, garlic or gasoline, he can kind of faintly detect something, and he took that as a hopeful sign.
Yeah. No, and it's good. Taste and sense of smell are related to nerves, and nerves are very slow to regrow. So we talk about a year before you can say, boy, this isn't going to happen.
Dr. Chapman, I'm going to toss out a few things I've seen on social media just to get your response. Sure. And I know some of this is wrong, frankly, but you're the expert here, so I'll ask you about it. One concern is, well, people are dying from the COVID shots. How valid is that concern?
So it's extremely, extremely rare. We have, in the world, I believe, and again, I'm sorry, there are so many numbers out there that I hate to even try and quote things, but I believe we're at over 400 million doses in the world. Mm-hmm. There are people that are going to die after getting the vaccine, and people say, well, it must be the vaccine. But there are people that die every day, and just because they had the vaccine, that's where I think sometimes things get a little mixed around. To my knowledge, there are single digits of people that have died related to the vaccine, and it's related to allergic reactions, which, unfortunately, people die from allergic reactions from antibiotics and other drugs we give on a rare occasion. There have been some very rare reports of blood clots, and I know there were one or two deaths that were probably related to the Janssen vaccine. In women, I believe they use 20 to 50, so that's why they're not recommending the Janssen vaccine for females in that age. But it is so small. And then when you talk about the number of people who died in the United States alone, 650,000 people have died. I guess, again, nothing is perfect, and I guess part of the discussion I have with people is every day we ingest things, chemicals in our food, medications. There are just a lot of things that we ingest, and I'm not trying to pick on drink alcohol, but smoking and alcohol have a direct link to cancer. Right. And so again, I don't choose to smoke, but I choose to have a glass of wine. I know that it's very rare, and I'm willing to take that risk. But I wish I could help people put things in perspective. That the things we see in the hospital and the people right before they're about to be put on a ventilator, almost 100% of the time you hear, I wish I would have gotten the vaccine. And our nurses and our intensive care unit doctors tell this story again and again.
AM 650 KGAB, Cheyenne's #1 news talk radio station. You're in tune with the Weekend in Wyoming program. On the phone, I have Dr. Jeffrey Chapman. Dr. Chapman is the Chief Medical Officer at Cheyenne Regional Medical Center. We're talking about the COVID vaccine. I'm asking him about some things I've seen on social media. Dr. Chapman, something else I've seen recently, and I don't know if this number is correct or not, or if there's any basis in fact, but people are claiming that roughly 65% of the people infected with COVID in Israel have been vaccinated. Is that true?
So there was a study that suggested that there was a high rate of people infected with the Delta variant in Israel that were vaccinated. I think the important thing to look at is how severe their infection was, and that number is certainly not the experience we're having in the United States. And there are a number of studies, and people have published news articles about it that dance around that, and so I wish I could tell you the absolute exact numbers, but I think again, if COVID-19 turned into a cold for everyone, this whole issue would be done. The real question is, how effective is the vaccine at preventing hospitalization and death? And I believe there's a follow-up study to that talked about how many people were actually hospitalized and died in Israel who were vaccinated, and it was a much lower number. But yes, I'm aware of that data, and again, the vaccine is not perfect. But we have to look and say what are the chances that you're going to end up hospitalized or die. At least in the United States, the numbers are very, very hard to argue with that it is worthwhile taking the tiny risk of getting a vaccine to avoid that.
Dr. Chapman, another common argument I see on Facebook in particular is, well, this was rushed through. They got this through in a hurry. They didn't look at it closely. Who knows what the effects will be? How would you respond to that?
Yeah, and it's understandable. And I think, too, if we go back, part of the reason people are having trouble trusting the vaccine is if we go back to the start of this, when you looked at what the CDC was saying and the World Health Organization, we got so many mixed messages. People were trying to make statements, using the best of the data and the information they had. At first it was, don't mask, save the masks for the healthcare workers. Be careful because the most common way the COVID vaccine is spread is through contamination on surfaces, and question of whether it was aerosol or droplet spread. So there was just a lot of conflicting data and a lot of anxiety around it. And so and I went off. Remind me of the question. I apologize. I started going off on that, and repeat the question for me. Well,
I was just talking about how, and I see this all the time, the comment along the general lines of they rushed this stuff through. It's a rush job. We don't know what's going to happen. You may all drop dead in 5 years. Who knows? In other words, they don't.
And I'm sorry, I got off on that tangent. So it's a great question. So what I think people have to look at is how much time, how many hours were spent developing the vaccine. And so for a vaccine for something that's not a pandemic, for example, I believe it's the HPV vaccine, they tested it on about 2,500 people, and this was over months because they had trouble finding volunteers, and a very small number of people were working on developing the vaccine. If you actually look at the number of hours, people who were dedicating all their research in the academic centers and at the CDC and that sort of thing, it was huge, and it was probably more hours and more data than we had for other vaccines. Even the trials, and it's been long enough that I can't remember the exact numbers again, but I believe for Johnson & Johnson and Moderna it was 40 to 50,000 people each. So they tested the phase 3 trials on 100,000 people as opposed to an average of about 2,500 people for vaccines developed in the last 10 years. So it was, I think the best way to look at it is it isn't that it was rushed through. It was that a lot of people were spending a lot of time, but the timeline was condensed, as opposed to something like the HPV vaccine, where maybe somebody spent a month, and then 6 months later they spent another month. They enrolled people in the study, and maybe it was 2 or 3 a month, and so the timeline was spread out over years. And so I again, no one can 100% say until we get 10 years out that there's no chance of any long-term effects. But again, I think you got to go back to looking at what the efficacy is, and the amount of people who've died. In the world, I've got the Johns Hopkins pulled up on my screen right now. 4.6 million deaths in the U.S. in the world. That's a lot of people, and I guess I go back to my litmus test is always, do I feel comfortable recommending it to my family and to my friends and that sort of thing? And it's absolutely without hesitation.
Doctor, another argument I've heard, and this has been going on for a while as well, is, hey, look, the death rate's 1%. You don't change your life for a thing that may kill 1% of the population. How would you respond to that?
Yeah, no, and again, I understand that. The problem is that if you are unlucky enough to get COVID severely and die, it's a horrible thing for families. I have coworkers who've had more than one family member die. And it is small, but when we compare it to, things like, motor vehicle accidents and drug overdoses and, things that unfortunately we've kind of just learned to accept in this country, it is so much greater number of people dying. And the other big concern, quite honestly, from my standpoint, is that currently Cheyenne Regional, we are stressed. We are trying to take care of people who have non-COVID related illness, and we are so overrun with patients, it's stressing our ability to take care of people with other health problems, and that's something across the country. It is also affecting healthcare workers across the country, and Cheyenne is no different. We're seeing an exodus of people from all kinds of healthcare positions because they are just stressed and tired, and they also feel like, gee, I'm putting my own health at risk and my family's health at risk, having to day in and day out take care of people who have COVID-19. Now, we have people in our facility, they are just stepping up day after day, but I also understand where after a while they're saying, I just am worried about how long I can do this for. And so my big concern, again, is I don't want to see anybody get sick, have a long haul. I don't want to see people die, but we're also running the risk of stressing our health systems where we can't take care of non-COVID related things.
How close?
We have put a moratorium on non-urgent or emergent surgeries, and the term that's thrown around is elective surgeries. What really our decision point is, and we use a scale called a MENT scale that says what are the chances that delaying the surgery will affect the patient, how complicated is the surgery, et cetera, et cetera. But we are putting off some surgeries because not that we think are going to affect people, but, for example, people who need their knee replaced or their hip replaced. Their long-term health probably won't be affected, but they're in pain. And, a lot of them have made plans to try and have this done with work and family. So that's my biggest concern. I understand the argument, and it's absolutely right. Most people do not get sick, but when we start stressing our healthcare system, potentially affecting your loved one having a heart attack and coming into a hospital, and they just don't have the resources, or needing a ventilator for another reason. We have had to expand our ICU. Normally, we have a 15-bed dedicated unit. Well, we have had to expand out onto one of our normal medical floors with 10 beds, which pushes our number of total beds in the hospital down. And for weeks, we have been absolutely full, and we are having to keep people down in the emergency department until we can find a bed on the floor for them. And they're certainly well taken care of down there, but it decreases the number of beds we have to see patients in the emergency department. So it takes longer. I feel horrible. People are having to wait in our emergency department sometimes for 2 or 3 hours before they can be seen. And so it's the downstream second and third level effects, not just the death and morbidity that we're seeing, but also the effects on the other parts of our healthcare system. That I say that argument that only 1% of people get sick. I just don't think that holds water. This is affecting a lot of things, and also the economy. I think we're doing a better job of saying, gee, we don't have to shut everything down, but I'm worried. There are reports across the country of schools having to shut down, and because they're just having so many COVID cases. And if you look this current round of the Delta variant, the number of kids hospitalized is, and I don't have the study in front of me, but I believe it's 5 times the number of kids hospitalized and 10 times the number of children requiring ICU beds. And again, small number of children, but that's a big thing. It's starting to stress our pediatric hospitals.
And I think people are misled about that because initially, with the initial strain, the thinking was, well, it doesn't really attack children.
That's correct. And again, people are absolutely right. The number of kids that get really sick is small, but you also have to remember that the kids that get the virus are also the kids that are going to, not intentionally, infect their family members who are going to go out in the community and infect other people. And so it's multiple pieces, and we can't just avoid talking about the kids here because it's a tiny percentage that get real sick.
Doctor, we're down to less than a minute left. Any last thoughts on this subject for our listeners this morning?
Well, real quickly, I think one of the biggest things we're seeing is people are starting to lose hope, and I just want to convey the message we will get through this, and I think we can go about our activities safely, and I just want to encourage people to get the vaccine. If anyone wants to talk to me about the vaccine, they're more than willing to call the hospital, and someone will get them to me. I can't promise it'll be immediately, and I will have a very reasonable conversation with people, and I appreciate you giving me the time to give my opinion, and I wish the best for everyone.
Dr. Chapman, we appreciate your time this morning.
My pleasure.
Have a good weekend.